All right, it is 1:31. I'll call the meeting to order. And the first item on the agenda is the executive session. Okay, review qualifications of applicants for public employment, RCW 42.30.110, parentheses 1, parentheses G. I don't know.
But
You were going to jump.
Randy, how many minutes do you guys need? 15 minutes.
15 minutes.
To include the board, Brandy, and Amanda.
Each board, Brandy, and Amanda. All right, sounds good.
Thank you.
So at this time, we'll recess into executive session. Out of executive session, and they're going to return to the same executive session RCW for another 10 minutes. At this time, we will recess into executive session. We've come out of executive session with no decisions being made. We're back in regular session. Is there any?
Sure, I'd like to go ahead and make a motion if I could. So as a member of this board, I hereby propose after further review from the recruitment committee and senior leadership representing the agency that we make an offer to employ Janae Parent as district administrator for BFHD. I'll second it.
We have a motion and a second. Discussion. Any discussion? So
I was just going to ask, can you again describe the process that we went through to select the applicant?
Well, I believe we had 12 applicants.
Okay.
Of that, we reviewed those 12 applicants. We narrowed it down to 5. Okay. From there, we got members of the board to interview 3 of the selected people, and of those 3, Janae was selected.
And we also had members of human resources there as well, and other members of staff in there as well.
And you attended, correct? Yes, you were there. So is there anything more that you want to add about the selection process we went through?
No, I think we're good. Brandy, I think the chair covered it pretty good.
Yes, sir.
Any other discussion?
So basically, if I understand correctly, the process involved external candidates with different qualifications that have been studied. A team has been selected to kind of screen, and then eventually came down to Janae after review and recommendations from the members, and essentially that's what we're doing right now, right?
Yeah,
just want to understand the process.
Okay. And I think long as we have, an employment contract that's created by HR and staff attorney or the attorney in reference to goals, education, and compensation, all those things, we have markers to move forward. I definitely want the bar to be raised from good, better to best for staff here. I think we can go ahead and do that. Also, looking at, there's going to be an empty position. There has been an empty position for a deputy district administrator. I would like for us, at least the first go around, to work with the new, if we do this, district administrator for that hiring process as well, at least for the first time going.
So is there any other further discussion? Hearing none, all in favor say aye.
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 Opposed? Passes unanimously.
Congratulations. Well, until you see the offer.
Thank you. I appreciate it.
Okay, now we're moving into another executive session. Do you know for how long we need this executive session?
This one we're going to start with 20 minutes.
20 minutes. So we're going into this executive session discussion with legal counsel about the current and potential litigation under RCW 42.30.110 parentheses 1 parentheses I.
Yes.
For 20 minutes.
Yes, to include the board, attorneys, Chris Mertens, Christopher Curley, and Hollywood Endurance, in addition to Brandy from HR and Amanda.
And at this time, we'll recess into executive session for 20 minutes. We come out of executive session with no decisions being made. We're going to recess for another 10 minutes under the same RCW. At this time, we'll recess into executive session. All right, we've come out of executive session with no decisions being made, and we're on to item 3, approval of the April 24th regular Board of Health meeting minutes. Is there any corrections, revisions, or additions?
Mr. Chair, I'll move approval of minutes.
I second.
There's been a motion and a second. Any discussion? All in favor, say aye.
Aye.
Moves us down to public comment. Is there anybody in the room for public comment or anybody online?
Oh, we have a hand. I'll ask you to unmute.
Hello, my name is Brandy Williams. I'm an epidemiologist on site and also the Protect 17 co-president of the BFHD union. And I am just wanting to get some clarification. Was Janae nominated for the position or given the position? I might have missed that.
She was given the position through an interview process of 12 candidates.
Okay, great to know. Thank you.
Thank you.
If there are any further comments online, you can either raise your hand in the app, or if you are on a phone, you can press *9 to raise your hand through the phone.
Lauren, will you pull up the participants list so you can see?
Well, it's
While we're waiting, is there anybody in the room for public comment? Are you coming forward? Raise hands. We're good. Okay, we're going to move on down to senior staff comment. Is there any senior staff? None today. Move on down to unfinished business. District Administrator Recruitment Committee update. I think we've already done that.
Randy, do you have anything that you need to finish up? Yes.
Thank you. So with the motion for the candidate, that basically is putting you guys on notice and letting you know that I'm going to go ahead and close up the District Administrator Recruiting Committee. Appreciate everybody, Katie and Commissioner Alvarez, for participating with that and assisting through the process and everything for that. So thank you.
If I want to make one comment on the question. Janae was selected, not given the position. So it was a process. Just want to make sure it's clear.
Thank you. That's great clarification. She was selected.
Thank you.
Given sounds like under there.
Yeah.
All right, we'll move on down to Pasco office relocation. I think, Janae.
Yeah, so I'm gonna make this very brief for you all, just to let you know that we are continuing conversations with Franklin County, Mike Gonzalez. We're continuing conversations with attorneys. We're continuing conversations with Rob Ellsworth. And then we've also enlisted the support of Bruce, who's an architect who's gonna help us with some space planning, kind of taking a look at what our needs are and then what those needs, how those needs can be addressed in the future. I'm hoping to bring a presentation to you all next month in June.
I'm sorry, where's the location, proposed location?
We haven't made any official decisions. We're considering several properties. The one we're leaning towards is off of Court Street over in Pasco, and it is right next to the Goodwill there, right across from the Autoplex and Post Office. Yeah, it's a great location.
All right. With that, we'll move on down to item 7, new business, Office of the Health Officer update.
Dr. Krager.
Dr. Krager.
Hello, everyone. It's good to see you all. I am going to try to present some slides. First of all, I just want to say it's been a great first few weeks at BFHD. I've already learned the acronym and how people say it. So anyway, I wanted to touch on a couple updates and then just a quick few slides about kind of smoke. And I saw a headline about a wildfire, I think in Canada, and it got me thinking about, wildfire smoke. So I have a few things about that. I'm going to try and share. Let's see if this works. Maybe. Oh, there we go. Yes. Okay. Almost there. So many windows. There we go. All right. Can you all see that?
Yeah.
Yes.
I'm going to try this. Oh, can you see that? Okay. Okay. We talked. So I briefly touched on, avian influenza last time. I don't have a lot on it. You know, we're still kind of watching what's happening. I did just want to highlight some places you can go to look to find more information. This is the CDC's kind of general summary site, which is good. You know, there hasn't been a number of huge updates since we talked last. There's been a few more outbreaks in cattle, in dairy cattle. We've seen a couple in Idaho recently that were just reported. So, you know, obviously that's close. It kind of just depends on how, you know, cattle move around the country, that is. But we are watching it closely for the reasons we kind of talked about last time, just the potential, you know, right now it's an animal health emergency, but we're just monitoring and watching it, and kind of, you know, preparing in case we see more cases in humans. It hasn't happened yet. There's still only been 2 over the last 2 years in the entire country. So thankfully, we haven't seen more human cases. What we're doing to prepare, I think I touched on this last time, is basically if we end up having a dairy with, you know, infected cows, we would monitor those agricultural workers, those workers who got contact potentially with raw milk or potentially with the cows who were sick, and make sure they don't develop symptoms. If they did develop symptoms, we'd help arrange testing for them. So this is a map of the country where there's been highly pathogenic avian influenza, H5N1, however you want to call it. So again, Idaho's seen some. The only human case from dairy to human was in Texas. So what else did I want to touch on? Oh, there was a great question about, you know, other animals. Last time, so no, we have not seen it in deer or elk. There have been some random other mammals, foxes, raccoons. So in general, we do want people, you know, if you see like a dead or sick animal, to avoid it, call the Department of Agriculture, and they may come out and test it. That's especially true of birds, but really any sort of animal out in the wild. And then obviously, you know, we want our dairy producers to be prepared, you know, closely monitoring their cows and then testing if appropriate. That was my brief update on that. And then I know there's a lot of other things, so I want to fly through this well, not fly through it, but go through it quickly. Because a lot of it's pretty straightforward, but I still feel like it's, you know, an important thing to kind of remind people about. So like, why do we care about, you know, wildfire smoke? From a public health standpoint, I mean, it can unfortunately cause, especially for our most vulnerable people, you know, significant illness. It can lead to exacerbations of things, and lead to people having to go to the hospital. Long term, it can also cause, you know, certain problems if you're exposed to smoke over long periods of time. Oh, was there a question?
No,
okay. So just as a broad overview, this is a graph of wildfires over the state. I don't know if you can see my mouse or not, but over the state of Washington over the last decade. This is reported fires. They're pretty flat. This is just flat, like number of fires reported. I think the more interesting number is the graph below it, which is acres burned. We've had 2 more mild than average fire seasons the last 2 summers. I'm not going to say any more than that, but, you know, we've obviously had larger seasons in the past. So, and, you know, it's hard to predict, right? What's going to happen. You know, if we have drier weather, obviously that can contribute. Sometimes it's just kind of, you know, human behavior. There's lots of things that go into that, but that's kind of what we've seen recently in regards to acres burned. So, you know, why we care about wildfire smoke, this is kind of what it's made of. So particulate matter, so little small pieces of, you know, burnt wood mostly, and other things. Carbon monoxide is a part of it. There's other gases that are a part of it as well, other volatile or organic compounds. This is just kind of like how small of things we're talking about. These are particles that get measured, and it's actually part of like the AQI number, air quality index number that you may see talked about. I'm going to touch on that briefly too. We've probably all been exposed to smoke, maybe even just like a fireplace, or having a bonfire outside. Obviously, if you're exposed to a lot of it, burning eyes, you may cough. Some people, if you have like lung disease, you may, have an exacerbation of asthma or COPD. And then there are some known kind of risks. This is generally people who, are around smoke for an occupational reason, but we do see some higher risk of, cardiovascular diseases and respiratory diseases, as well as lung cancer. We're obviously smoke can affect healthy people, but we're also talking about, especially people that are most vulnerable, children, adults over the age of 65, lung conditions, pregnant women, people who smoke, people who've had a stroke. These are all people who are going to be a little bit more likely to have health issues. This is that wonderful air quality index. I see it on my phone now when you pull up the weather app, which is kind of cool. So if we're under 50, we're in the nice range. Moderate is 51 to 100. And then it's, if you're especially sensitive, you might want to lower your exposure. This is and then we kind of just get more and more unhealthy, right? I think everyone should start to limit exposure, especially when it's, over 100, and then for sure when it's over 150. And then anything really above that is kind of like, only go outside if you absolutely have to, and honestly find other ways to kind of improve your air quality indoors, which we're going to talk about briefly. I have a link to this map that talks about air quality across the state. I think preparing by asking your doctor and making sure you have medications on hand, just in case you can't get out and about, especially if it's like an asthma inhaler or something like that. If you want to have, better quality air in your home, you can have an air filter. You can make a box fan with a filter. I'm going to show a little picture of that. Or if, your central air unit has one. Car, if you're spending a lot of time in a car, you can also get HEPA filters for your car, your filter. This is that map that I mentioned, and this was taken this morning. So there's a couple places around the state that are in this moderate range. Lewiston, and then a couple places in the Seattle area. Kennewick, we were pretty good in the green. Okay, I'm almost done. This is a interesting picture of like a really intense sort of box fan filter. There's a simpler way to do it, but these box air fan filters, I don't know if you've seen them before. They work really well to improve air quality, believe it or not. It's like a simple kind of solution. You use just a basic box fan and you tape together air filters, like home air filters for your furnace. So recirculating air is important, especially in a vehicle. If you plan to do outdoor activities, you might, think about other indoor ones. And then while they're not perfect for this situation, because they're not going to filter everything, an N95 or an N100, which we haven't heard much about, can reduce, and this is, again, I'm thinking about people who have to be working outside, can reduce your risk of health effects, although it is important to wear it correctly. Okay, we talked about the air quality map. When we do have smoke exposure, reducing outdoor activity, especially people who have health problems. And then anyone, with kind of more serious symptoms like shortness of breath or chest pain should seek immediate medical care. All right, this is a nice little thing from UW about how to build one of those more simple ones. You just need one furnace filter, usually a 20 by 20 by 1, MERV 13 and above to get the kind of the best bang for your buck in terms of filtering particulates out. And then you can tape it on, you can use bungee cords, and you just turn it on. Oops. Depending on how often you use it, it can last for months. And how much, smoke it's filtering out. Just some other things to think about in regards to like indoor air quality, vacuuming can like stir up things, candles, fireplaces, using gas stoves, all those can make indoor air quality worse. So if you're already, be able to smell smoke in your house because it's so smoky outside, it's probably not a good idea to do those things. Okay, I did check, and it sounds like we've had indoor shelters at really smoky times in both Benton and Franklin counties, where people can, public places where people can go and they have good air quality. This is especially true for people that are not able to seek shelter in some other way. We talked through some of these, like alternative and then, alternative activities, and then an N95 or N100 mask if you have to be outside. Okay, let's see. I think that's it. I have a couple other resources. This is a really nice guide that we use, especially for schools. I don't want to go over the whole thing because it's quite big, but it's essentially like, what does air quality look like? And then what should we do about activities outside, especially for like sports and things like that. So this is some great guidance that we use that we help our schools make decisions around, whether to do an outdoor sport or something like that. Watching Smoke Blogspot is not just about smoke, but also just about fires. So there's some great resources there. And then our BFHD website also has some resources around smoke and wildfires. Okay. Hope that wasn't like too much information, too fast, but that's all I had today.
Thank you.
I will just add, we have made those Corsi Rosenthal boxes for my son's high school when we had the really bad fires in 2021, and they turned black. So they're cheap and easy to deploy. Simple for schools.
All right, we'll move on down. Thank you, Doctor. We'll move down to review and approval of resolution 24-05. May is Mental Health Month.
Thank you. Thanks everybody. This is getting to be sort of an annual ask we have of you, but especially in relation to the current community health improvement plan. We know behavioral health is a priority for our action plan. And so what we're going to do is provide a little bit of background and context for our request before we ask. Kelly Hernish will review some data and also review content for that Katie Clute was going to present. She got called back to work and couldn't stay any longer. So we'll take care of her and then we'll make the ask of the resolution after that. You want me to move that up?
I'm okay. Thank you. We'll just get our data slides up here and I'll review a little bit of the data. I know we're short on time, so I will go as quickly as I can, but please feel free to stop with questions if you have any. The first slide is really about the availability of mental health providers based on our population. And so we can see in Benton County, the ratio for our mental health provider to population is 280 to one provider to 280 residents, compared to Franklin County, which was 690 residents to one provider. Of course, we know people can travel across the river to seek healthcare providers of any kind. And so we looked at the Benton-Franklin combined rate, and that's about 350 residents per provider. What you'll see in the upcoming slides is, there still is a need for mental health care. And we can't imagine that one provider can serve quite as many people as right now they have the need to, not of course all 350 people want mental health care services or need them, but the ratio is still pretty high. So we'll look at the data and see kind of what the lay of the land is on the data. We'll start with adults and then we'll look at youth data. So adult mental health data from the Burfus survey is the percent of adults reporting poor mental health days for the last 14 or more days in the last 14 or more days in the last 30 days. So the majority of the days in a month. We can see a little trend upward. There's a lot of jagged lines when we look at the county level data because we're a smaller population than the state, but we're following along with the trend that the state is seeing as well, and no significant change in the course of the last 15 or so years. Okay, next slide. And when we look at non-fatal intentional self-harm or suicide, attempted suicide, we are looking at the data for Benton County and Franklin County, Benton in teal, and then Franklin in magenta. There's comparable in Benton County to Washington State, and then a significantly lower rate in Franklin County. Franklin County rates haven't changed significantly, but we do see some increases there in Benton County. Slide. And then intentional self-harm with individuals who did die by suicide. This shows the age breakdown. So this is showing in the navy blue our 65 plus population, and that population is peaking at a higher rate than the other age populations. What we also see in that magenta population is our kind of younger adults. So the 18 to 34-year-olds, we're seeing an increase in that age population as well. We'll see at the bottom, that's the 0 to 14-year-old age group. So, you know, while we're always encouraging and supporting youth mental health, we do see that the risk for suicide is much, much higher in our adult population, maybe due to access, maybe due to less familiarity with mental health care landscape. So that's what our data shows at this time. And we'll look at youth data, and this is a little preview of something that's coming up. So I do have some slides that are actually part of an event that we have next week that I'll share more about. But this is data from the Healthy Youth Survey, and these are students who have felt sad or hopeless for an extended period of time. We can see that there's a small decrease from that 2021 to 2023 timeframe. The 12th graders are in navy, the gray represents our 10th graders, and then 8th grade is in magenta. While we're happy to see a little improvement there, what we do also see is that it's roughly a third to 40% of our students who are feeling sad or hopeless for an extended period of time. So it is trending a little bit downward, but it's still pretty prevalent in our youth. And then this represents students who have attempted suicide in the last year. What I don't know is this a recurring attempt or a one-time attempt? But we're trending throughout the last, 8 or so years of roughly 10% of our student population having experienced suicide attempts. And then these are students who heard or saw information. So this is a little more positive. Heard or saw information about warning signs of suicide and how to get help for themselves or a friend. So we do see an improvement specifically in our 8th grade population of recognizing the signs and knowing what to do with that information and where to seek help. So that's an encouraging trend to see that especially the younger groups are starting to get that information sooner and knowing where to seek help. And then this slide shows a lot, I realize, but it shows us the adverse childhood experiences for each age group. So magenta is our 8th graders, 10th graders in gray, and then 12th graders in navy blue. And we see different columns. So there's 0 adverse childhood experiences. So those are events that have the ability to cause trauma that can be long-term for youth up until their adulthood. And so we see in 2021 and 2023 comparisons for 0 adverse childhood experiences, we lost students in that category. So we have less students in 2023 who experienced no adverse childhood experiences versus looking at the 4 adverse childhood experiences, we actually saw an increase in all age groups of students who experienced 4 adverse childhood experiences. And so it's very plausible that, it's not that the 0s moved over to the 4s, but the 0s moved up to 1. 1s may have moved up to 2 and so forth. So we're, hoping to work on some community building and helping to improve our outcomes for our youth. Okay, and then this is another positive. So students who had an adult to turn to when they felt sad or hopeless, seeing a little increase between 21 and 23. So that's encouraging as well. We see 6th graders at a straight line. So the potential for engaging with children at a younger age, so they know about that connectedness and the importance of a trusted adult. And then this brings me to an event that's happening next week. I'll set this here. There's a QR code on the flyer. It's the State of Our Youth Symposium being put on by our one of our coordinators in the health district doing a great job. There will be a panel discussion, a more extensive data walk, and there will be members of the community who work with youth and work with youth specifically on safety and mental health and talk about what services are available in the community and best practices. And there will be facilitated conversations as well. And that will be at the Three Rivers Community Center. You're all welcome to attend. There's still space available. So in summary, people of all ages in our community do experience mental health challenges at various times in our lives. And some are temporary and some are long-term and chronic. We are seeing challenges with our adult population with regards to suicide risk. And then access to mental health care provider is limited due to the high resident to provider ratios. That's not unique to Benton-Franklin counties. That's a nationwide issue. So I know there are efforts underway to expand access nationwide and locally as well. Resilience to adverse childhood experiences can be really mitigated by community connections and mental health therapy, and then meeting people's social determinants of health. So when we have our basic needs met for shelter and food and we're feeling secure, it's a lot easier to then start addressing some of our behavioral health needs. So that's my slide deck. And then as Carla mentioned, I'm filling in for Katie, who is going to talk to you about the Mental Health Awareness Month and the work of the subcommittee of the Behavioral Health Committee. So the Behavioral Health Committee is a really great representative committee of multidisciplinary partners who come once a month to talk about ways that we can align all of our coalition work with the Community Health Improvement Plan. And behavioral health is a key priority in the Community Health Improvement Plan. So this month, the Mental Health Subcommittee has put on quite a really impressive set of activities. So I'll set this out here. This is the slide, or this is the flyer for what they're working on this month. And you can see all the community partners who participated in the work of the Mental Health Subcommittee. They've done daily social media posts, and we'll continue that throughout the month on issues related to positive and inspirational messages, upcoming events, tips on self-care, and so forth. They've also distributed yard signs throughout the community with positive messages of hope and reminders that they matter. They've done the Take the Moment, and that is, oh, that's on that slide, excuse me, on that flyer. And that helps raise awareness about mental health by uplifting and empowering the mental health community to take a moment. Some events that the subcommittee is shining a light on by posting flyers, social media events are training in youth first aid. So those students will have more awareness of what to do if they themselves or a friend is experiencing mental health challenges. Suicide awareness and prevention. And then there's a CBC wellness fair, Mental Health Awareness Fridays by Wearing Green, and then a walk and roll event raising awareness for LGBTQ youth bullying, suicide, and self-harm prevention. It's here. Asking is Caring, and that's a program to help educate parents on supporting their children's mental well-being and recognizing when the child might be in crisis. And then Resilience and Hope is an event created to support local youth. Help is 3 numbers away. I really like this flyer to help our community understand how 211, 988, and 911 can be a collaborative approach to seeking care, and that there's a warm handoff if a call is made to 211, but the individual really could use some mental health services. They can be, very carefully referred to the 988 call center. And so that's a really great tool. The Behavioral Health Committee sponsored and attended Mental Health Awareness Night at the Dust Devils game. That was last night. And the committee sold tickets to the game with $1 per ticket going toward Strides Against Suicide Walk that takes place every September. So I'm not sure on the counts on that from last night, but that's always a really great way to raise awareness and money for that walk. They also handed out information on mental health, red flags, suicide prevention, and agencies and providers where people can seek help and get treatment. Any questions?
Questions? I would just like to add that I like to watch the real life movies on Netflix when I do get a chance to watch a movie. I watched a movie called Grizzlies, and it is a very powerful movie. It was so powerful that I went to bed that night. I had a hard time sleeping, and I watched it the next 2 nights in a row. It's about mental health. It's about a teacher that goes all the way up to Alaska to teach. Suicide rate there was the highest in the nation. And it's an incredible movie, how he turns these kids around, and it's a purpose in life. Lacrosse has a play in it. Grizzlies. I would encourage you to watch it. It's a very, very good movie.
So I will read the resolution that we are asking the board to pass. So the Benton-Franklin Health District Resolution number 2405, May 2024 as Mental Health Month in Benton-Franklin County. Whereas mental health is an essential part of overall well-being, impacting individuals, families, and communities throughout Benton and Franklin counties. Whereas 1 in 5 American adults experiences a mental health condition each year, and everyone faces challenges in life that can impact their mental health. Whereas despite its prevalence, mental health remains shrouded in stigma, preventing many from seeking help. Whereas early intervention and access to quality care are crucial for managing mental health conditions and improving quality of life. Whereas May is recognized nationally as Mental Health Awareness Month, providing an opportunity to raise awareness, combat stigma, and promote mental health resources. Whereas Benton-Franklin Health District Board of Health is a unified governing body representing both Benton and Franklin counties that promotes the betterment of public health. And whereas the month of May has been recognized as National Mental Health Awareness Month since 1949. Now therefore be it resolved that the Benton-Franklin Health District Board of Health does hereby proclaim May 2024 as Mental Health Month in Benton-Franklin counties. Be it further resolved that the Benton-Franklin Health District Board of Health, we encourage all residents of Benton and Franklin counties to educate themselves and others about mental health conditions, treatment options, and available resources. Challenge stigma by speaking respectfully and inclusively about mental health. Seek help if they are struggling with their mental health and encourage others to do the same. Use 988 to seek resources, to seek help for yourself or others. Support organizations that provide mental health services and advocacy. Create safe and supportive environments for open conversations about mental health. Together, we can create a community where everyone feels empowered to prioritize their mental well-being and seek help when needed.
So we look for a motion.
And you're looking for a motion.
Going to be as simple as move to approve resolution 24-05.
Okay, that.
There's been a motion, a second. Any more discussion? All in favor, say aye.
Aye.
Aye. Moving this down to proposal for health officer recruitment committee. Randy.
We're working hard today, Brandon.
Like I'm always working hard for you guys. All right, so thank you. As we have been actively recruiting for our permanent health officer position, I would like for you to consider and propose a committee, a health officer recruiting committee that would consist of an elected member from each county and then one non-elected member to work in conjunction with some of our internal leaders to help through the process for our health officer hiring and recruitment measures. And I'd like you to consider that, please. Any questions?
I would consider that. Get on the committee. I don't know how you get on the committee.
We just wanted, we were hoping to get a motion to have a committee and then the members that would participate on the committee.
I would move that we have a committee to recruit our public health officer.
Second.
There's been a motion, second, for a committee to recruit our health officer. And now members for that committee, or I guess we should.
Yeah. Go ahead and vote.
All in favor, say aye.
Aye.
Okay, now we need to put together the committee.
Yes. We're hoping to get one from Franklin County, one from Benton County, and then non-elected. If you want to change the structure, you guys can do that too.
See, unelected is right here.
Carolyn volunteered.
So we got Carol, Franklin County.
Sorry, I haven't been
Have a good conference.
Being in jail.
Sorry.
Appreciate
Should we put Will on there?
Yeah.
it. I like it.
Since he's not here.
We got Will for Benton County and then Franklin County. Okay.
Thank you.
All right.
All right.
Thank you.
Okay, we got that put together. Next is announcements. Any announcements? Hearing no announcements, we're looking for the approval of vouchers. The number of $840,820.81.
Move that the Board of Health approves payment of voucher numbers 33-2024 through 37-2024, $840,820.80.
Second. The motion and second. Any discussion? All in favor, say aye.
Aye.
Aye. Next meeting is June 19th, 2024. And
So we do have a little snafu with that. That's a holiday, so we will not be here. But we just wanted to run that by you guys, see if you want to.
I know Ben.
Going without you.
Well, Benton-Franklin Transit has canceled their meeting. Why? Do we want to do that or do we need to meet in June?
whatever.
I'm just asking.
A week later? You wanna do a week later?
That's fine with me.
Okay, yeah, we can go a week later.
So it'll be June 26th.
Correct.
Our next meeting will be June 26th. And Will McKay will be back in the
That's
chair.
right, he will.
Yep.
Okay, we're adjourned.
At this point, we'll adjourn the meeting. Thank you very much.